probably
also
just
within a
kind of
mobile
made
setting,
me
huh?
more, doing this job has made me more like, because I see some patients that are really sick and really need to change some lifestyle stuff. So even with this program, we do like coaching, we do some coaching with them and try to help them know that like water's very, very important in Arizona. And that, if these older people aren't getting enough water, they're going to be in more pain. So,
Right.
but yeah, so I've kind of expanded, some things in my business, which is good. Yeah.
Nice, nice. I mean, and so I know all over the country, I've talked to probably thousands of nurses around the country, and most of them have heard of like the cash pay mobile IV programs. You can just sign up. There's a company that's got a blanket medical director. You can go out and do cash IVs. And most of the nurses I talk to say it's fine, but it's hit and miss because somebody who wants an IV today might not want one for months,
Right.
another one for months, or if somebody wants an IV, they want it like right now or today, but they
Right.
aren't scheduling it for a week out. So it can be kind of stressful, and it's hard for people to plan for that when they don't know when someone's going to want it.
Right.
Um, and I've talked to people who do concierge, other stuff, med spa stuff. I've talked to lots of nurses who've done that. They'll go around and do mobile Botox and along with an IV and facials and all sorts of stuff in a mobile scenario. And I've talked to a number of people that do that. So I mean, it just kind of depends on your preference, what world you want to live in. And I've talked to some nurses that had been. There was a nurse, one in particular I'm thinking of, where she was doing a couple different things. She was working with our company too, but she backed out of all of that to just focus on doing mobile cosmetic stuff on her
Right.
own. And because she just wanted to have fun, she wanted to get away from treating people for problems and issues, and just go and work with people who just wanted to. I mean, literally for vanity's sake, if you will, just
Right.
cosmetic stuff like that. She just wanted to have fun and be happy and not worry about having to try and help someone that has a complaint or an issue. And that's just her preference. And I think that nurse in particular had been in some pretty heavy nursing, emotionally heavy nursing roles for years. So she was like, I'm done. I'm done with the emotional drag that I go to work every day, and I'm required to engage in some very, very sad things, and I'm just tired of that. She's like, I just want to get away from being pulled down, not because I don't want to help the patients or anything. It's because I carry it with me. She's like, I carry it home. I think about it. I'll dream about it, and it's just hard. She's like, I need to do something just fun and light. And I told her about the pain program. She's like, that sounds great too. She's like, but I'll tell you what. She's like, honestly, I wouldn't even want to do that. I would just want to go and do facials and Botox for people that just want to have a Botox party and do some
Yeah.
IVs and everyone talk and laugh. And I was like, that's wonderful. It sounds like you need a break from the difficult aspect of healthcare and nursing. But I will say most people who've done the pain program that you're doing, Kim, I've heard lots of people say a very similar thing, that this gives them a chance to see someone actually get better, and kind of turn a corner, at least from where they were, into a positive direction, right? And like you're saying, Kay, before Kim came along, you're having a much more difficult time with everything,
Oh,
and
yeah.
and now you're saying, it's, I guess I don't know if you would call it a 180. Is it a 180 for you, a complete reverse course?
Uh, Absolutely.